AP 120, Chapter 7, Topics, Joints and Movements. So, joints are junctions between bones, where bones come together. And joints are also known as articulations. Now, there are three main types of joints. There are fibrous joints, like sutures, cartilaginous joints, and synovial joints. Now, fibrous joints are immobile joints held together by dense connective tissue. These are not supposed to move. They're supposed to connect the bones together, very strong connections that will hopefully never separate. Classic example, of course, being the sutures in the skull. Then we have cartilaginous joints. Surprise, surprise, cartilaginous joints are where bones are connected by a piece of cartilage. And a piece of cartilage can be either hyaline cartilage or fibrocartilage. Cartilaginous joints may allow for some movement, but only a little bit. Mostly they're not movable, but they might be able to move a little bit. Examples include the intervertebral discs found between the vertebra and the pubic symphysis that connects the two os coxae together. And then we have synovial joints. Synovial joints are most of the joints of the body. They are the joints that allow for movement. So pretty much most of the things you think of as a joint is a synovial joint. Now, synovial joints have a capsule. So they have a joint capsule that forms a cavity. The joint cavity, is then filled with a fluid called the synovial fluid. So there's actually a little bit of fluid separating the bones that are coming together at these mobile joints. Of course, at the ends of the bones is the articular cartilage, that hyaline cartilage, allows for extra protection. And these are structures you will find in all synovial joints: the cavity, the capsule, and the articular cartilage. There are also some other structures that may or may not be found in or near a synovial joint. You have the menisci. Menisci are fibrocartilaginous pads that help to hold bones in position and provide a cushion. Then you have bursae. A bursa is a fluid-filled sac. It's filled with synovial fluid, helps to protect the joint, to help separate structures per se that shouldn't be rubbing against each other. So in the knee, we have three bursae that help to protect the knee. All right, now we have different kinds of synovial joints. Synovial joints are defined basically on their structure and how much movement is allowed at that joint. The most mobile joint is the ball and socket joint. It allows for the most movements possible, which means it's multi-axial. It's composed of a big rounded knob fitting into a deep depression or socket. So here, the head of the femur fitting into the acetabulum for the hip joint. And motions include flexion, extension, hyperextension, abduction, adduction, circumduction, and medial and lateral rotation. All right, then we have condylar joints. For instance, the condylar joints between the metacarpal and the phalanx, where we say move our index finger. Condylar joints, again, have a rounded end fitting into a somewhat more shallow depression. They allow for a lot of different motions, so they are multi-axial. Not as much as the ball and socket, but pretty close. So flexion, extension, abduction, adduction, and circumduction are all possible with condylar joints. Then we have plane joints. Plane joints are where you have two basically flat surfaces next to each other, and the bones then are allowed to slide next to each other or twist even. So movement can vary, but it's twisting and sliding, so it could be things like flexion, extension, hyperextension, or abduction, adduction. So for instance, the bones, the carpals that help to form the wrist joint are mostly forming planar joints. Then we have the hinge joint. Hinge joint, again, a rounded bone fitting into a depression or cup-like structure of another bone. But hinge joints are very limited in the motions possible. They allow for only one category of movement, so they're often referred to as uniaxial. So they only operate sort of like a door and the hinges of a door. So for instance, here's the elbow joint, and all that occurs here is flexion and extension. Flexion and extension. Okay, then we have pivot joints. Pivot joints have one piece of bone with another bone coming around it, and this allows for rotational movement around that axis. So in this case, the axis's dens is forming the axis of this joint, allowing rotational movement. And this is a uniaxial kind of movement because all it can do. Then we have saddle joint. Saddle joint is sort of a weird structure where you have two curved but not cupped structures that fit into each other, sort of like a guy sitting on a saddle of a horse with his legs coming down on either side. Hence the name saddle joint. Saddle joints are biaxial. They allow for things like flexion, extension, and abduction, adduction. And the only saddle joints that I know of are where the first metacarpal articulate with the trapezium way down past the base of the thumb. All right, joints. There are some disorders associated with joints, such as arthritis. And arthritis is broken down into three main categories. There's Lyme arthritis. Lyme arthritis is often caused in someone who becomes infected with Lyme disease, which is a bacterial infection that is spread through the bite of ticks. This is more common toward the East Coast. I used to live in New Hampshire, and they found there that every dog in New Hampshire basically has Lyme disease. Then there's osteoarthritis. This is probably the most common form of arthritis. It just develops slowly over time from the chronic use of our joints, and the joints basically just degenerate and wear down over time. And then there is rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disorder. This is a disorder where the person's immune response is attacking the tissues of the joints. And this leads to inflammation and swelling of the synovial membranes, helping to form the synovial joints, causing a lot of swelling, can cause bones to pop out of place, very painful, and leads to a lot of eroding of those joints. Here is the hands of someone with pretty severe rheumatoid arthritis. All right, movements. I've given you a lot of names for movements and I haven't yet really explained what they are, so now we'll do that. All right, so flexion and extension. Flexion and extension is where you basically bend the structure along a longer structure. So for instance, here is the knee. When the knee is fully stretched out, you get a straight line. But when you bend at the knee, you end up making the angle of that straight lines being 180, gets smaller. So as you flex at the knee, the lower leg approaches the thigh. The angle between those two structures gets smaller and smaller until they're as small as they can get when you're completely flexed. And then when you extend the lower leg after you flex the knee, the angle, the distance between the thigh and the lower leg get longer and longer until it's fully extended and forming that 100-degree angle straight line again. So flexion, they get closer. Extension, they get further apart. Lateral flexion is when you bend the vertebral column to the lateral side. Now there's also a movement called hyperextension. Hyperextension is when the extension continues past that straight line position. You cannot do hyperextension with the knee or the elbow. But there are other joints where you can. So for instance, the shoulder joints, the hip joints, the wrists, all allow for hyperextension. Then we have abduction, adduction. Abduction, adduction is where the structure, say the limb or finger, is moving either further away from the midline or toward the midline. So abduction is moving away from the midline, and adduction is moving down toward the midline. Abduction, moving above. Adduction, moving down. Then we have circumduction. Circumduction is basically a combination of abduction, adduction, and flexion and extension, so that you end up forming a circle with the distal end of that structure. Then in the foot, at the ankle, we have dorsiflexion and plantar flexion. Dorsiflexion, moving the foot so that the toes are facing up, going up, and plantar flexion, moving the foot so the toes are going down. Plantar flexion is going down. When you stand on your tiptoes, you're actually plantar flexing. All right, then we have medial and lateral rotations. These are easier to see when you have, say in this case, the elbow flexed. So you got this angle here for the arm. When you medially flex, it's twisting the arm toward the midline medially, twisting it in, and the forearm will move inwards. When you laterally flex, you're twisting the arm at the shoulder joint so that the forearm is going out laterally. Then we have supination pronation. This is actually a movement for a joint that's between the head of the radius and the capitulum of the humerus, but we most easily see this twisting rotational movement in the palms of the hands. So with supination, you twist the forearm so that the palm of the hand is facing anteriorly. And when you pronate, you twist the forearm so that the palm of the hand is facing posteriorly. Or you can think of it as if you have your hand as a bent, a flexed elbow joint, and your palms facing up. Supination is holding a bowl of soup. Pronation is pouring the soup out. Supination, pronation. Then down at the foot, we have inversion and eversion. Inversion is turning the foot at the ankle so that the bottom of the foot, the sole of the foot, is turning more medially. Eversion, turning the foot so the bottom of the foot, sole of the foot, is turning more laterally. Inversion in medially, eversion out laterally. Then we also have protraction retraction. Protraction is when you move a bone anteriorly. So we can do this with the mandible, protract it, stick it out, and then retraction is pulling it back posteriorly. So you can protract and retract the mandible. You also can protract and retract the pectoral girdle. Then we have elevation and depression. Elevation, moving the bones superiorly. Depression, moving the bones inferiorly. And elevation and depression in this area is actually moving the pectoral girdle. So this is a motion of the pectoral girdle. This is not occurring at the shoulder joint. This does not occur at the shoulder joint. This does not occur at the shoulder joint. Maybe some of you remember that. Also worth noting that you can elevate and depress the mandible, which of course allows us to do things like chew. All right, and that is it for Chapter 7.